Hi everyone, my name is Vera, this is Sid, and today we're going to discuss the healthcare system in Russia and in India. Are you ready?
Yes.
All right, so, and the first question which we're going to talk about is how does the healthcare system in your country work? Is it public, private, or a mix of both?
So in India, it's I would say it's mixed of government and private, and then some of the health insurance people have getting, and the government also giving the facilities for the government employees, and also the people of India. But it's have a limitation of the price limit. Like 5 lakh rupees, they can do it
Per year?
once in life.
Once in life?
Yeah. So. Yeah.
Okay, so again, it's a mix of the, like, let's say public and private, right? If you work for government, they give you like insurance
Yes.
somehow, and then you can use it, right?
Yeah.
Okay, and then you also have private clinics for sure, right, in India?
So you can also buy the health insurance in India. Like
Okay.
different companies, they are doing the health insurance. And if you're working for the good companies, the big hotels, big IT companies, and they also have connected with this insurance company. So when you work in a company and you're employee of
They
the company, they
provide
also
you.
provide.
But for example, if you are, let's say, not working for a good company, then you don't have insurance unless you don't buy it yourself, right?
Yeah.
So all the even government or public clinics, you need to pay money if you want to have some
Yes.
medicine
So
facilities there.
for the normal people, those who are not working for the company or anywhere, so government have one card called Ayushman. Ayushman is a card where it's covered 5 lakh rupees in case of any kind of medical emergency you
Okay.
face.
Because in Russia, we have, of course, we have, let's say, public clinics, which are government ones, and they are free. Medicine in Russia is free. Of course, sometimes it's not like a very high advanced technologies, but still, if you get sick or something, or I don't know, you break your leg, for example, this happened to me, you go to the any clinic, which is government one, and they provide you a free service. And then, of course, we have private sector, which is more expensive. Like in general, it's expensive because you need to pay money there. And some people think if you go there, you get a better service. But mostly, all the doctors who works in the government clinics, they work in the same private clinic. So it's the same doctor. It just, the feeling, I think, which private clinics give you in Russia is that you come there, they treat you better because you pay money, so they offer you like water or coffee in the entrance and something, and they have better communication, let's say. I think this is for what you pay money. And maybe some high technologies, yes. But in general, the doctors are mostly the same. The best pluses of Russia is that you have free medicine there.
But do you
and
have?
You don't need insurance or something. It's just free. Anyone.
But do you have a private hospital as well, right?
Yes, yes. Private hospitals
Hospital and a
everything.
clinic.
Yes.
So it's allowed for the doctor who's working in a government company to work in a private hospital.
Yes.
Really?
Yeah, they can work. Yeah, in both.
Okay, that's
And of
good.
course, in private clinics, they paid more.
Private clinic
than
because they
government.
own it. So I think
Yes.
that's more logical. But working in a private hospital and government for I don't think for me it's like very new. So I think that's very good. So you meet the same doctor
Yes.
which you
Yeah.
already aware about. So
And I think it's also good for the doctors because mostly they meet a lot of clients in the government hospitals, right? And then some of these clients, like patients, they can also later on go to your private clinic and pay some money, which is also good for you because you just meet more people in a free clinic, right? Yeah, that's it. Any questions?
well,
Just for the Russian
question.
system, no? Okay, then we're going to the next question. The second question. What are the most common health concerns faced by people in your country? Like diseases or something?
So it's been like 5 years. I was not in India, but it's been like 1.5 years I'm here. Especially after the COVID, if I talk about, there are a lot of people are dying with a heart attack.
Heart attack.
Yes, and they have facing a lot of sugar patient and lungs issue. I think maybe there are other diseases as well, but these are the, I would say, major concern after the COVID. I think it's not only India is facing this; the across the world have aware about it, the consequences of this COVID.
COVID, yeah.
So Yeah, I would say
So you would say heart attacks, lungs, and what else did you say?
I think the lungs problem,
Lungs, heart,
diabetes,
and diabetes.
and
Yes.
heart attack.
Okay.
I think these are the three major thing I would say I have seen, which is much common across
Okay.
India at the moment.
Yeah, I think lungs is because of the pollution, of course, as
Yes,
well.
yes.
And then heart and diabetes, I think because of the food.
So yeah, I think yeah, sweet is one of the reasons. They're eating a lot of sweet and food, deep fried food is there.
Yeah, deep fried food,
And I
oily.
think it's not because of their food what they're eating at home. I think it's the influence of the food which they're eating outside. Because you don't know how it's making
Yeah,
and
of course.
how it's done, how the oil is, how old this oil is, how much sugar they're using.
For Russia, I would say, like, I also don't live there already 5 years. But I think we have there a lot of cancer.
A lot of cancer.
Yeah, my grandma died because of the cancer, and one more relative of mine also died because of the cancer. So I think, yeah, cancer is a common health concern, I think, in Russia. I don't know why, just this is happening. And I think also like heart attacks, but I think it's mostly because of the age and the lifestyle which you have. And diabetes, I'm not sure. Lungs, no, I think we have a like normal, it's not very polluted in Russia, like comparing to India or China, for example. So I think cancer, like to my mind.
But do you really think so that the cancer patient is higher just because of maybe genetics?
Maybe genetics, yes. We can Google it. Let's ask ChatGPT. It's also saying respiratory organs like lungs. And
Yes.
then
This is a common problem in the world now.
I think, yeah, it's all because of the COVID.
Because cancer is not really a popular disease. It's, thousands out of one person have cancer.
And it also says that additionally, Russia has historically faced challenges with a high alcohol consumption, which contributes to various health issues, including liver diseases and accidents.
Accident is not a part of disease. So.
Yeah, I agree, but yeah, I think alcohol is also affecting a lot. And like Russia is popular for this, which is not nice, but yeah, this is what is happening. So maybe also, yeah, some liver diseases and everything, high pressure, blood pressure.
Yeah, heart disease.
Which goes to the heart.
Blood pressure.
Okay, I hope just everyone stays healthy. Look after your lifestyle. Eat good food. Don't drink alcohol too much, and then yeah, just look after your health. It's the most important thing in your life. Okay, are we ready to go to question number 3?
Ready.
How affordable is medicine and healthcare in your country, especially for people with low income?
So yes, India do have some government hospital. Okay. The only challenge they have facing in the hospital that there's a queue. Okay, and it's a country of a lot of poor people. I'm not saying that all of them is poor, but most of them they cannot afford the private hospital because of course medical is something I would say in India is categorized. If you really want good treatment, you go for good medicine. And I think it's just a status, I would say. It's all about the clothing. You can get 100 rupees good clothes. It doesn't mean it's bad. It's just how your status shows how much you can afford. So, yeah, it's a country where you can afford medicine in a cheaper price. I'm pretty sure about this. I have bought it sometimes when I have just tonsil pains. So, I don't think so medicine in India is expensive.
Okay.
It's one of the good things. Yes, the treatments, I would say for few diseases, when people have it, it's very difficult for them to afford.
And what about the like pills?
Yeah, pills is cheaper. Like pills, that's what I'm saying. Only the treatments of some of the like disease, surgeries.
Yes.
But if you go in a government hospital, you have the government rates, so it's not expensive. But again, it's a queue of people, those who are waiting in this.
Okay.
And yeah, so medicine, no, but treatments of certain diseases, are much higher price. So it's difficult.
Pharmacies, do they work 24/7?
There is few. I think every city, yes, because some kind of emergency people need. Of course, anyways, in a hospital, it's available 24/7.
And then I think it's also, it's not like a, how to say, you don't see the pharmacy in every step, in every corner of India, I think.
No,
Right?
there is. I think every 1 kilometer you will see pharmacy.
Yeah.
Yes.
Maybe because I just don't pay attention to this. Because in Russia, pharmacies, I think, every step. Like any city, you go pharmacy, 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 pharmacy. It's like metro. Metro station has pharmacy nearby, always. So, and in general, it's a very popular business as well. Okay, I will tell you about Russia then. So I already told from the first question that you have free medicine. So it's very affordable, even for people who have low income or something. They can come to the government hospital and have the treatment there. And then if you have money and you want something more like high level, advanced, then you go to the private hospital and pay some money and get it. Question number 4. What role does alternative medicine like Ayurveda in India or traditional Russian medicine play in healthcare?
Oh,
It's a long topic.
I think it's a very huge topic.
Yeah.
But yes, there are few doctors who do a study about the allopathic, Ayurvedic treatments, and I personally believe in this. I haven't seen any experience, but I believe in this. There's certain kind of herbs and spices really make a difference in your health. And of course, the treatment, those who are doing it, they are very advanced. They study about it. And I believe in this treatment, I'm not saying.
In Ayurveda.
Why not? It exists there. It's a history of India. It's history of every country. I think every country have treated before with the herbs and spices. They didn't treat it by this medicine. But now we use sources. We do it so much easier. But yeah, in India there are a lot of people those who are prefer this kind of treatment. They actually doing it, and there are so many retreats, hotels in India are growing, since decade. And yes.
And then because I know that you don't like pills, like you prefer to have some. I don't say Ayurvedic, but some natural things, right?
Because
to
it's
treat
my,
yourself.
I think it's my personal choice. But sometimes few people, those who are creating the medicine, is not a good quality. People are die with some kind of pills if you're not prescribed by the doctor. If you're having a pill by yourself, it can react on your body. So I don't really want to use to the medicine until unless it's not prescribed
By the doctor.
Yeah. So it's not like I don't like it. If I feel it, I have it. But I don't prefer
Okay.
to have.
But I'm a fan of medicines. Like I'm a fan of pills. I believe that if I get sick, I take some flu
Yeah.
medicine, whatever, and it helps me. Maybe just because I think about this, but I do take pills if I feel sick or have any pain. I'm not a person who I don't honestly believe myself in traditional, like let's say, medicine. It exists in Russia as well. I think it's similar to Ayurveda. It's also about some
It's like
spices
homeopathic and allopathic. In India, we call it homeopathic and allopathic. So these are
So it's basically when you use like some grass, whatever, and then you make some
medicine.
drink or whatever, and then you drink and you feel good. It exists, but honestly, I don't believe in it.
Because they kill what I study all this time of people those who are treated by this kind of treatment. So it's kill your disease from the roots. So it's killed completely. It's a long process, 6 months, 7 months, 1 month treatment, but it's kill it completely. Again, it's all about the belief of people. And
But see, for example, the like heart diseases or again lung diseases, this grass is not going to help. It should be advanced
I think
pills
there's
which you take and really
I
affect your
completely
blood
understand
pressure
there
and
are few
everything.
things which can only done by the surgery,
Yes.
as we are aware about it. But if it can be done by the medicine, why not it's done by the Ayurvedic treatment? I think there are people, those who are study this, they are much better person to give a statement about this. It can done or no. But again, surgery can be done by surgery.
Yeah.
There is no doubt.
So yeah, that's why in Russia we also have this alternative medicine. Let's say I don't do that. There are people who do that, who believe in this and practice this. It's just I think up to the person what he wants, like pills or traditional medicine. It's all up to them. But yeah, we also have it. How has technology affected healthcare in your country? For example, health applications, telemedicine, etc.
So I think yeah, I would say it's changing a lot, and technology. I think it's one of the important thing everywhere, every sector. It's not only medical. So yes, we are welcoming this kind of technology, which make your life easier. Okay, but still it's a bit far. I would say for Indian medical system again, because you're dealing with a number of people, and the machineries and kind of stuff is much expensive, and you also need to educate amount of doctor for this kind of technology when if you have it, and it's not only because it's a big country, so and they have like hundreds of cities. I think more than 100 cities are
Yeah.
there. So just imagine you need to place all this equipment for number of people, those who live there. So
And then maintain it.
yeah, and maintain it. Yes, is one of the most
Yeah.
important thing to maintain. But yes, as we see, it's growing, and it's very important, the technology, and I think it's making a difference. Yeah.
I think in Russia as well. For example, this September I went to Russia and I did a full body checkup in one private clinic, and they did everything. Like they checked my heart, my all inner organs, whatever, my blood, la la la. So and it was very convenient that I come there, I give them my passport, they register me, and then I have application where only me can get in, like inside, and whenever I have any results, they send it there. So you know when, for example, and you can also do the appointment through the application to any doctor. Like I want to visit, I don't know, dentist, la la la. I put the date, choose the time, done. It's done. So I don't need even to call anyone or ask for availability because I see everything in the application. As well, later on you can apply for taxes there, some stuff like this. So I was like impressed because I haven't been doing this checkup for quite a while, and before in Russia it was always you need to go again to the. Usually we were going to the government hospitals, and it's a queue, and you go there, and then you need to call to check it out how it is, to get the results. Now everything is online, appointments, results, anything, and I think it's very convenient, and I'm happy that it's growing. I know that it's sometimes advanced equipment makes the price higher for some treatments, but I think it's worth it. I hope one day it will be just free for everyone, and everyone can get access to any kind of treatment technologies and everything, just to be healthy. Because I think without health you cannot do anything in your life. So yeah, that's it.
That's it. Very good. Thank you so much.
Thank you for having this conversation with me today. I hope our followers like it. And
Eat healthy and don't eat medicine until unless you don't feel it.
yes, make your own choice. Thanks for watching
Thank
this
you so
video.
much.
Like, share, and comment.
Yes.
Bye.